Hi, everyone. I'm Cari Frank, the Vice President of Communication and Marketing for CIVHC.
This is Ioana, Data Scientist and Director of Healthcare Reporting for HSRI.
And we're going to be talking to you about advancing health equity and using data to understand the impact of social factors on healthcare use in Colorado. So what we'll do is give you a little background about our health equity analysis. You'll learn how to use the tool. We'll talk to you about some selected findings, and then we'll have time for questions and answers. So part of the data that we're going to show you today is based on the Colorado All-Parent Claims Database, which CIVHC manages, and HSRI is our data warehouse manager and analytic partner. We have over 1 billion claims in the APCD, which represents the majority of covered lives, over 70% in the state. Basically, the only thing that we're missing is federal programs like VA, TRICARE, Indian Health Services, uninsured and self-pay claims, and the majority of the ERISA-based self-insured. But it's still very comprehensive, and we do a lot of work publicly and non-publicly with the data to advance healthcare. So this is our first time actually looking at health equity with the database. And if most of you probably are aware, but up to 80% of a person's health is related to social factors or what we call social determinants of health that may be beyond their control. And these are things like race, ethnicity, income level, housing, and transportation. So we wanted to really understand what are some of those drivers of health equity in Colorado. And what we wanted to do was help policymakers, providers, health entities, any community members working on health equity really understand what kind of social determinants are impacting their neighborhood and communities the most, and where they might want to focus efforts to impact health access and health outcomes. So what we did was we looked at American Community Survey data published by the U.S. Census Bureau and social vulnerability index information that comes from the Center for Disease Control. Both of those are publicly available resources, and that's where we got our social determinants of health data. So we looked at income, education, employment, housing and transportation, which was a composite social vulnerability index measure, and also the race, ethnicity, language was a composite measure as well. And then we paired that with 6 different healthcare measures out of the APCD that were already built in our community dashboard. And that's another public report. And we looked at access to care, quality, cost, and utilization. So I think the exciting part is actually seeing the dashboard in action. So we'll do that now. If you go to our website, it's civhc.org, and under the Get Data tab, Public Data Focus Areas, you'll find the health equity analysis if you want to go there and play around with this tool at any point in time. We would love to have feedback on it as well. So please go use it and let us know what you think. But over here on the left-hand side, you have some filters. The first is the social determinants of health. So again, you have the income, education, employment, housing, and transportation, or race, ethnicity, and language. And then you can look at the healthcare measure of your choice. So we have 2: access to care, which in this case is lack of access to care for both children and adolescents as well as adults. The quality measure that we chose to use for this purpose was no follow-up after an ED visit for mental health within 30 days. The cost of care is total cost of care per person per year. We also looked at 2 utilization measures of ED visits, all ED visits, and then also potentially preventable ED visits. I'm going to click on potentially preventable. We'll keep it at income. You will get a warning sign sometimes. You just click away on that, ignore it. We don't know why Tableau does that sometimes. But what you will see here is a scatter plot, and each of these little dots represents a different census tract. So the reason that this report is even possible is that we geocoded the APCD for the first time starting in 2020, which assigns a latitude and longitude point for each resident or member that's in the database. So we're able to report at the census tract level now within the database, and then bring in census tract level data from those external sources that we just mentioned. So right now we're looking at all of Colorado. What you also get here is a Pearson's correlation coefficient. So that tells you the strength of the relationship between the two measures that you selected. So we're looking here at a 0.57, which if you look at those little pop-up that comes up, the R value scale, you don't have to memorize it. We put it right there for you. But if a 0.57 lives between the 0.4 and 0.69, which indicates that it's a very strong relationship. So as the percent of people that are living below poverty increases, we're also seeing an increase in potentially preventable ED visits. But there's a wide range, right? So if you are interested in understanding, this is the highest percent, or one of the higher percentage of folks living in with below poverty line, and then also is a very high percentage of potentially preventable ED visits, a high rate. But that's in Pueblo. So you can dig down even deeper and look at the data based on a different county of choice. So we can dig into Pueblo, and then you will get a different scatter plot. And so here the R value changes. So it's an even stronger, very strong relationship here in Pueblo between those two measures. So, but then you can look at the county and look at, between census tracts, even very different outcomes, because this is a green, which indicates it's a little bit better outcome in terms of fewer ED visits and a lower percent of folks living below the poverty line. One other thing I'll mention before I turn it over to the insights is that you do also have the breakdown of race and ethnicity over here on the left-hand side. So now we're looking at Pueblo. You can see that they have a 43% Hispanic population. If you clicked on one of these neighborhoods in Pueblo County, that will change depending on the neighborhood that you're looking at. So I will go ahead and go back to our presentation, and I'm going to turn it over to Ioana to talk to you about statewide insights and findings.
So for the main key points for statewide level pairs of measures, looking at social factors on one hand and the healthcare measures on the other, we observed that social factors were strongly related to higher potentially preventable emergency department visits. They were also strongly related to adults not receiving preventive health care. However, they did not impact children and adolescents receiving preventive health care and did not impact the total cost of healthcare services. And they were only moderately to weakly related to follow-up care after visiting the ED for a mental health need. So once again, those were at the statewide level. If you were interested in a deeper exploration of the city of Denver, for example, we selected a few data points from the dashboard that were used for the creation of an infographic, and excerpts from that infographic are presented here. Because Denver is a densely populated area, the default dashboard view will not be the best view for this exploration. So once again, as Cari demonstrated, you would want to select the county of Denver, which is the same as the city of Denver for geographic boundaries, and you would then get only the data points of interest. And so here we demonstrate 4 different neighborhoods that have that demonstrate the relationship between the poverty, percent of population in poverty, and the potentially preventable ED visits utilization measure. So we see that as the higher the percent of population that is in poverty, the higher the percent of population that visits ED for potentially preventable needs. So even in adjacent neighborhoods like Sunnyside and Highlands, this is the same relationship. And also if we were to look at more distant neighborhoods like Elyria, Swansea, and Cherry Creek, this is the same. So lower share of people living in the poverty line translates to lower percentage of residents that had a potentially preventable visit. The same is possible to see on the next slide for another pair of measures. In neighborhoods with more diverse populations, fewer adults have access to preventive care. So, in conclusion, this tool can provide insights for the geographic areas of interest to answer questions like which neighborhoods appear to have the greatest unmet need for access to care or preventive health care in my county, or what is the range of values for the selected social determinants of health in my county relative to the state and also across the neighborhoods in my county. And then also, as Cari demonstrated, looking at the racial and ethnic composition of the population in my county or in my neighborhood, and how does it compare to the state. And in the same vein, this health equity analysis tool can look at statewide more globally to see the variation in healthcare and compare rural and urban neighborhoods. There's a specific drop-down selection to look only at the rural or urban neighborhoods and see how they vary in regards to the healthcare measures and the social factors. We can do this both separately and in correlation to each other. Cari, back to you.
Thank you, Ioana. And we look forward to your questions.